Hello everyone, my name is Darsil Shah and today I am going to talking about the mandible bone. Okay, the mandible is the largest bone of the skull. It's make a lower jawline and this is the handmade of the mandible bone. Okay, this is the superior view, this is the inferior view, this is the anterior view and this is the posterior view as you can see. Okay, and the mandible compose has the two parts, the body part, this is the body part and this is the ramus part has the two process, the condylar process and coronoid process. Okay, so mandible bone is developed from the first pharyngeal arch and the nerve supply by the mandible nerve. The mandible bone, the body part, has the two surface and two border. This is the outer surface and this is the inner surface. This is the upper border and this is the lower border. Okay. This is the outer surface of the body part of the mandible has the first the symphysis menti. Okay, this is the symphysis menti, this is the mental foramen. Okay, and this is the body has the mental foramen. Okay, this is the between the premolar teeth, two premolar teeth between the mental foramen. Here as you can see the mental foramen, this is the oblique line. Okay, here the oblique line, this is the incisive fossa and this is the mental prominence. Here is the mental prominence and this is the all about the outer surface of the body part. This is the inner surface of the body part has the mylohyoid line. This as you can see the mylohyoid line and the upper the sublingual fossa, this is the sublingual fossa, this is the submandible fossa. Okay, here is the submandible fossa, this is the sublingual, this is the submandible fossa. Here the genicular tubercle, this is the four genicular tubercles. Here the genicular genioglossus and geniohyaloid muscles attach here the genicular tubercle. Okay, and this is the upper border, this is the lower border has the base of the mandible and upper border is the socket of the lower teeth. Okay, and this is about the body part of the mandible. Thank you. So as you can see, this is the ramus part of the mandible, this is the ramus part of the mandible. Here okay, the ramus has the two surface, this is the lateral surface, this is the middle surface. This and ramus has the four border, this is the upper border, this is the lower border, this is the anterior border and this is the posterior border and two process, this is one process and second process. Okay, the lateral surface has the bear the number of the oblique line, here the bear the number of the oblique line, and the middle surface has the mylohyoid groove. Here you can see the mylohyoid groove. Okay, and the upper border has the mandible notch. Here is the mandible notch, here as you can see here the mandible notch. Lower border has the made. Okay, the base of the mandible and this is the anterior border has the thin and the posterior border is the thick. Okay, here is the two process, the condylar process and the coronoid process. The condylar process is the posterior superior part of the ramus, this is the anterior superior part of the ramus. Okay, here is the coronoid process and here is the condylar process. So thank you, this is the all about the ramus part of the mandible bone. So here mandible bone has the four ligament. The first ligament is the temporomandible ligament. Here the temporomandible ligament. Okay, the second ligament has here the stylomandible ligament. Here the angle of the mandible, this is the stylomandible ligament and this is the spinomandible ligament. Here you can see the spinomandible ligament here, and also you can see here the pterygomandible ligament. Here the attach the pterygomandible ligament, there is the four ligament. The pterygomandible ligament attach here. This is the stylomandible ligament attach here. This is the spinomandible ligament attach here, and the temporomandible ligament is attached here. Okay, thank you. So there is a 15 muscles attached on the mandible bone, and there is a 11 muscles attached on the body part of the mandible, and the 4 muscles attached on the ramus part of the mandibles. Here, as you can see here, the first muscles on the body part of the muscle, the buccinated muscles. Here the buccinated muscles, this is the depression labii inferior muscles, this is the depression orbicularis oris muscles, this is the mentalis muscles, and this is the orbicularis oris muscles. This is the platysma, here attached the platysma muscles. This is the very big muscles, the masseter muscles attached here. This is the temporalis muscles attached here. The inferior side, as you can see, the middle pterygoid muscles attached here. This is the lateral pterygoid muscles, the very smalls attached here, and this is the genioglossus muscles and geniohyaloid muscles, that is the attach of the genial tubercles, and this is the mylohyoid muscles, and this is the anterior belly of the digastric muscles. This is the platysma muscles, the lower part of the mandibles, and this is the superior constrictor muscles here. The superior constrictor muscles attach here. This is the all about the muscle attachment which you can see on the mandible bones. And thank you. So now we have to move on the relation of the mandible bone. There is a 7 nerve related to the mandible bone, and the 6 vessels related to the mandible bone. Here this is the facial vessels, here is the facial vessels, this is the facial vessels, this is the masseter nerve and vessels, it supply the masseter muscles, and here is the lingual nerve. Here as you can see the lingual fossa, here the lingual fossa, this is the lingual nerve. This is the inferior alveolar nerve. It's passed through the mylohyoid canals, and it is the mylohyoid nerve and vessels. And this is the maxillary artery. It is the all about the branch of the maxillary artery. This is the oculotemporal nerve. Here is the oculotemporal nerve. So this is the all about the mandible bone, the parts, the mandible bones, the relations, the mandible bones, the attachment, as you can see, and hope you will enjoy it very much, this video. And happy Diwali, happy new year. Thank you.